My name is Alex Renshaw and I'm an orthopedic surgeon. I'm at Highland Advanced Orthopedics and Sports Medicine. I practice orthopedic surgery and the specialization is mostly general, but I do specialize in arthroscopic surgery of the shoulder and the knee, along with joint replacements involving the shoulder, the hip, and the knee. My interest as a child was basically, I played a lot of sports, and so that was my primary focus, and that's what led me to college, which eventually bought me a Division I scholarship to play football and baseball. And then I suffered my first broken leg, which required surgery, and then during my rehabilitative process, that's when I decided to enter orthopedic surgery as a profession. Some of the experiences that I've had treating professional athletes stems from my fellowship, which was done in Dallas, Texas. Basically, the fellowship specialized in shoulder and elbow reconstruction, sports medicine, and joint replacements. And there we had the opportunity to work with Southern Methodist University, the Division I team in Dallas, Texas, along with the Dallas Mavericks. Basically diagnose and treat injuries that the players had sustained and perform physicals on the athletes. The conditions that I most commonly treat are injuries or chronic medical conditions that affect the shoulder and the knee. Primarily do a lot of arthroscopic surgery of the shoulder and arthroscopic surgery of the knee. And then the other things that I specialize in, a joint replacement specifically in the shoulder, the hip, and the knee. I also do take care of fractures involving the upper extremity as well as the lower extremity on an urgent basis if needed. The type of treatment options that I offer my patients are both surgical and non-surgical. Not everybody is a surgical candidate, and so we basically take the individual as a whole and decide what the best treatment is for an individual patient. If it ends up being that they don't need surgery, then by all means we have a good physical therapy team and other non-operative modalities that we can use here to treat people in non-operative fashion as well as a surgical fashion. The advances in orthopedics right now, I think arthroscopic surgery plays a huge role just because of the minimally invasiveness of the procedures. You can make much smaller incisions to get the same type of surgical care that was otherwise done in an open fashion with a bigger incision and more blood loss. The other things that in terms of advancing features in orthopedic surgery are definitely the robotic portion where things can be done in a more precise manner, especially total knee replacements. The knees seem to balance. People have better outcomes using robotics, and I think robotics is the future, especially in the field of total knee replacement. Joint replacement surgery can tend to be a very painful procedure, and being able to help control the pain using non-narcotic medications and other modalities that we can use before surgery, during surgery, and after surgery. And the goal is to hopefully do a joint replacement procedure without the use of opioid narcotics post-operatively. One of the things that can really help with that in the realm of knee replacements is not using a tourniquet. The tourniquet has been shown to basically increase post-operative pain, and it also increases swelling post-operatively. So my interests outside of orthopedic surgery are definitely spending time with my family. I'm married to a beautiful wife who is a dentist, and we have 3 beautiful girls, and we spend a lot of time together and play outside, and that takes up a lot of my time outside of the hospital. It is extremely rewarding to have a patient who comes in with an injury. You get to go through the whole process of education with them, reassuring them that their treatment is the best option. Then you get to take them to the operating room with our tremendous operating room staff, complete the surgery, have them go through rehabilitation, and see them regain their previous level of function and activity. Whatever that is for the patient, a specific sport, a job requirement, whatever it is that they need to return to, seeing them being able to get back to that is extremely rewarding to me.